Before we can look at the actual test involved in the lipid function test, let's look at certain precautions and considerations that we need to factor in to ensure that the results that we get are conclusive. So we have biological variations. I'm sure you can all appreciate that cholesterol levels increase with age due to decreased growth hormone, as well as the fact that women have lower levels of cholesterol than men, except in childhood and early 50s due to estrogen's pleiotropic effect on lipid metabolizing tissue. As seasons change, cholesterol levels change also, and you'll discover that cholesterol levels tend to be higher in cold periods as compared to other seasons. In terms of food intake, definitely the more fat you take, the higher your cholesterol levels are going to be. So patients should be on their usual diet for about 2 weeks, and they shouldn't be gaining or trying to lose weight when they take their test. Other medical conditions like thyroid, liver, and kidney diseases also affect the lipid function test results. Acute illness, again, affects the liver function test, and it is recommended that lipoprotein measurements should be made no sooner than 8 weeks after any form of trauma or acute bacterial viral infection and 3 to 4 months after childbirth. In terms of lifestyle, the higher the sedentary lifestyle, the higher the cholesterol levels, as well as poor diet habits. So let's look at sample collection. Measurements in capillary blood are lower than in venous blood samples, so you should always take note of that. And patients should fast for 12 hours before a sample is taken. Recent food intake exerts legal effect on plasma total cholesterol. However, triglyceride increase in postprandial plasma due to appearance of chylomicrons. These are usually cleared after 9 to 12 hours, so none should be present after a 12-hour period of fasting. Blood is collected into a glass tube, such as a red tube vacutainer, and it's allowed to stand for 45 minutes at room temperature to allow complete clotting. The sample is then centrifuged at 1,500 for 30 minutes at 4 degrees Celsius, then refrigerated centrifuge is preferred. Samples should be immediately placed on an ice water bath after centrifuge at 2 to 4 degrees Celsius. In terms of storage, the samples should be kept frozen at 20 degrees Celsius in a non-self-defrosting freezer until shipped to a lab. If shipment is to be delayed by 4 weeks, specimens should be kept at minus 80 degrees Celsius. Samples are not to be shipped on a Friday or a day before a holiday. I'm sure this is to make sure that there's always someone on the other end ready to receive them. Let's talk coagulants. So we use citrate and editor being the most preferred because of its ability to inhibit oxidation of lipids and proteolysis of lipoproteins. Citrate exerts a large osmotic effect, resulting in a falsely low plasma lipid and lipoprotein